Okay, Mayor Adie, we're all ready to go. I'll turn the meeting over to yourself.
Okay. Before we start, I'm on a new laptop here, so I'm trying it for the first time now. I don't see everybody on it. Is Rebeamo with us tonight?
Yes.
Yes, he is.
Okay, I don't see him on here. I see everybody but Rebeamo. So if
That's a stroke of luck.
Mary, I see him now. See him now. Okay. I'm just saying though, if this goes a wee bit, I don't see people, I might have to ask you just to jump in and speak as you will. So I'll ask for the calling of the roll, please.
Thank you. Mayor Adie,
Present.
Reeve Eamon,
I'm present.
Councillor Koulis,
Present.
Councillor Evans,
Present.
Councillor Hines,
Present.
Councillor Jameson,
Present.
and Councillor Sydney.
Present.
We do have a quorum, Mayor Adie.
Thank you. Okay. You're right on to the first motion, and before I start the motion, I just want to welcome you ladies here tonight to give this presentation. And so the first motion reads that Chris Ferguson, VP of Patient Care Services, Renfrew Victoria Hospital, be heard before council to provide an update on the community vaccine rollout program. Mover, please, on that. Councillor Jamison, seconded by Councillor Hines. Okay, I'll now turn it over to, I believe it's CAO Julia Boudreau is going to be given the presentation.
Thank you, Mayor Adie. Yes, it's Julia here this evening, and I'd just like to thank you, Mayor Adie and Council, for inviting us here and giving us the opportunity to present here tonight. I would just ask Mr. Bulmer if he would put up our presentation.
One moment, and we should be ready to put it up.
Thanks. Maybe I'll just make a few opening remarks. Certainly, we have had terrific support from Renfrew and from our partners throughout this pandemic. And I would say we certainly couldn't have gotten through the last 11 months without the support of everyone, including many residents who have provided donations throughout this and treated the staff and physicians here at RVH so well. I also just wanted to recognize the efforts. I'm joined here tonight with by Chris Ferguson as well as Dr. Angela Varon, and they have been leading this initiative on top of many other priorities, as you can imagine, that have been going on both at the hospital and with regard to the pandemic. And as usual, they've both done a top-notch job representing Renfrew Victoria Hospital and in the case of Ange, also representing the primary care physicians. Also wanted to just acknowledge the leadership of the Renfrew County District Health Unit. As you know, they have responsibility for rolling out the entire plan with regard to vaccinations, but not only in regard to vaccinations, but during the entire pandemic, they have really shown great leadership and much support to our organization. And lastly, I just wanted to sort of preface all of our comments this evening, myself and Chris Ferguson and Dr. Varon's, by the fact that this is a very fluid environment within which we're working with regard to the vaccination plan, and just to note that things could change from this point this evening. But our hope is that we'll provide you with an update as to our plan, which is of course part of the Renfrew County COVID vaccination plan, and be able to answer any of the questions that you might have. So next slide, please, Kim. So Renfrew County District Health Unit has established an incident management structure, and I'm just not sure kind of where everyone is at with regard to knowing about this structure. So I thought I would just take a second to point out that there is an IMS structure in place, and it is really responsible for overseeing all aspects of vaccine distribution and allocation. You'll see from the slide that there is a command table that has been established. And at that command table, there's representation from primary care, hospitals, paramedics, congregate care, and the Algonquins of Pikwakanagan. So below the structure, below the command table, there are several local planning tables. And we come to you this evening from the sort of Renfrew and area planning table, because the RVH, as you know, is responsible for vaccination for the residents of Renfrew and area. And again, just to point out, we have been working collaboratively over the last 11 months with many, many partners throughout this pandemic, and also for the purposes of enacting this vaccination plan. Next slide, please, Kim. So just a little bit of a history in terms of the last year at RVH. We have struck a command center within the hospital last April in the very early days of the pandemic, and that command center table was meeting weekly or more often at the call of the chair. And you'll see here that the command center was really an opportunity for us to bring together all of senior management, our physician leads with regard to the pandemic, our communications leads, as well as our administrative support. So it really was a structured forum that we would meet on a weekly basis, more often if needed, to cover off, the many topics that you see listed here on the slide. And then from that command center, we also struck an operations table, which also met weekly and or more often if necessary throughout the pandemic. And that was our means really of involving our department heads and other leaders across the organization in order to ensure that we were all on the same page and rowing in the same direction with regard to the pandemic. We continue to have bi-weekly meetings of the command center as well of the operations committee. So those are ongoing, and so just wanted to assure council that the same structure and the same team is now in place for the vaccine rollout. Next slide, please, Kim. So just where we're at in terms of the rollout of vaccines right now, many of you will know that we have established a vaccination clinic at 100 Health Village Lane, right on the health campus here adjacent to the hospital. And to date, you'll see that we have completed many of the priority populations as defined in phase 1. Just to note that there is a provincial as well as a county prioritization committee that determines these priority groups, as well as an ethical framework that's being used provincially that refines the sequencing decisions. So you'll see we've been focusing on long-term care, our highest priority, as well as very high priority healthcare workers, which are in process this week. And we have vaccinated our ALC patients who are in hospital with a confirmed admission to long-term care. And then our next priority will be adults over the age of 80, our partners in retirement homes, their healthcare workers and essential caregivers, as well as high priority healthcare workers here at the hospital. Next slide, please, Kim. So our vaccine clinic at 100 Health Village Lane opened a week ago Sunday on the 28th. And the first week of operation, we operated it during the day shift, if you will, from Sunday to Friday. We have had terrific support from many partners, from retirees, from the local physician group, from the paramedics, from volunteers, all pulling together to run a very successful clinic from the health unit in those first 6 days. And during that first week, 605 vaccines were administered, which was absolutely fantastic. It really gave us an opportunity to sort of test out the clinic setting, test out the processes that we had put in place, and make improvements along the way. So this is our second week this week, and with some feedback that we had received, we're trialing evenings this week. So there will be 3 evenings that the clinic will operate this week. That's operating as we speak right now. And we're anticipating by end of this week, another 432 individuals within that priority 1 group will have received their vaccines. Next slide, please. So this is really just a visual of, for those of you maybe that haven't stepped inside, the newest clinic on the RVH campus. It's a beautiful, bright space. There's lots of room for physical distancing, great traffic flow, allows lots of space for vaccine preparation, as well as monitoring patients or folks that have received their vaccine. So for post-vaccination monitoring. The tenants in the building, as you know, probably the building is for the most part full, but they've been very supportive of holding the vaccination clinic in their environment, and we're very thankful for that. And really our goal is to remain in this clinic as long as we possibly can, because it has proven to be very successful and very conducive to the work at hand. Next slide, please. So lots of considerations when we're looking for a space, and lots of considerations certainly went into choosing 100 Health Village Lane. As I've mentioned, as we move forward with planning, we need to be aware of the fact that the environment is very dynamic, and this has required up until this point, and is going to continue to require very nimble logistical responses and communications. We need to, throughout the process, be respectful of any directives that are coming from the province, from the health unit, as they do have accountability for this rollout, as well as for the prioritization framework, which could change with regard to the sequencing of individuals who are receiving the vaccine. We're trying to accommodate folks best we can in regards to the time and the time, like the hours of operation of the clinic, mindful of what times are convenient, what times there's drivers available for those that require drives. We need to be mindful, particularly now with the type of vaccine that we have received locally with regard to the storage and handling requirements. It's a very delicate vaccine, if you will, for lack of a better word. And certainly one of our top priorities when looking for location has been the safety, both for those that are receiving the vaccine, but also for our healthcare workers who are working in the environment. Throughout the course of last week and this week, we've literally been timing folks as they go through the vaccine, and we've been looking for every opportunity to maximize the efficiency with which we're administering the vaccine, so that when that wonderful day does come, that we have lots more vaccine than we will always be able to handle that amount of vaccine, but we want to ensure that we're doing it as efficiently as possible, and making sure as well that we're using every last drop of the vaccine that has been assigned to us. And so the next thing on the top of our mind is sort of how long will we be able to accommodate vaccination at 100 Health Village Lane? What is the maximum capacity there? And then when we sort of outgrow that location, where could we go? Where could we go next? Next slide, please, Kim. Maybe just before we jump to that, this will give you some sense of the numbers of people that we will be looking to vaccinate, and hoping that we'll have a very high uptake of vaccination. So you'll see that we still have remaining healthcare workers. You'll know that we're moving next likely to the 80 plus age group within the town. Again, just to note that that prioritization could change if we are given direction from the local prioritization table that needs to change. But just in terms of the number of folks within the town of Renfrew, and then the other areas within our catchment population that we're responsible for vaccinating. And then the next slide, please. And then we'll move on to vaccinating the remaining eligible residents of Renfrew and area. So overall, you'll see the significant numbers of folks that we will be wanting to vaccinate. It'll be, of course, dependent on the on supply of vaccine, but we're really looking forward to the day that we hope to be able to vaccinate 500 people in a day. And so that's sort of what brings us to you tonight with thought on a good locale where we could operate a mass vaccination program from. So this is our last slide, and then we can open it up. Happy to answer any questions. But again, we are looking for a space that would maximize all those considerations and qualifications that I spoke to earlier. Some of the ones maybe I didn't mention would be in regards to accessibility. We did conduct an accessibility plan at 100 Health Village Lane, and so we would want to ensure the same sort of great accessibility that we have there in another location. Really looking to find the best venue that would achieve all of these factors. So, you know, the space that we have available at 100 Health Village Lane and our co-tenants have been really superb, and everyone has done a fantastic job. I'm so proud of the team that has pulled this together in really short notice. And now we'd really like to replicate that success by finding the best place for our mass vaccination clinics. And so the location that we have sort of landed on, and where some of our other partners across the county have landed on, is at their local arenas. And so we've identified Mattaway here as an option that we would like to propose here this evening for consideration. And with that, that's the end, Mary Edie, of the presentation, and we're happy to answer any questions that anyone may have.
Okay, council, any questions? Reeve.
Thank you for this presentation. It's important, I think, that the public recognize there is a plan forward. I think what's been disconcerting has been there hasn't, we're getting a lot of chaff from Ottawa media about all of the wonderful things Ottawa Public Health is doing, and then the city as well. And they're talking about multiple clinics and drive-throughs and all sorts of stuff. So I think that's overridden the message, of our local community. So that it's very good to have this. I note your last slide, you didn't indicate dates, and I recognize there is a struggle because of vaccine supply, making sure of the consistency. So is there a period of time? I'm presuming it's not April 1st, 7 days a week through until October 31st. Is there sort of a back of the envelope series of dates and times so that we can still use the facility for our primary business, which is providing recreation?
So I'll start, and then I'll invite Chris and or Dr. Varon may have some more detailed response to that. As I said, we're really hopeful that we're going to be able to stay at 100 Health Village Lane for as long as possible. Some of that has to do with the vaccine that we currently have, as I've said. And so we're very cognizant of the fact that the ice is in the rink till a certain time, I think in April. We are hopeful that if we had to, and again, we're sort of a little bit not fully aware of when the next vaccine shipment will be, how quickly we'll get large volumes. So we're working, as I say, in a rather fluid environment, but one option that we had thought would be that we might be able to set up the clinic upstairs while the ice was still in the rink, and then when the ice was removed from the rink, that we move it down to the lower level, where again, by that point, there might be more volume of vaccine available to us, and we would be able to potentially put through even more folks in a day on the ice surface. Chris or Ange, did you have anything to add to that?
I always have something to add, so you can just mute me at any time. I've been living COVID for over a year now. So just to echo exactly what Julia has mentioned. So right now we're really limited by the amount of vaccine that's coming. And I completely hear some of the frustrations as we deal with it on a daily basis, the change in the number of vaccine coming. It's literally changing even more than daily, I would say, in the last week. Right now we're restricted in daytime hours, the kind of the Monday to Friday 9 to 5 by the parking lot and the waiting room space at the current location. So that's why the move to Mattaway upstairs would be ideal whenever that is available. I think right now we could continue to meet all of the amount of vaccine that's coming towards us where we are currently. It's just the restriction based on the parking lot because it is a shared building with other places. But when we do evening clinics and weekend clinics, we have been able to put lots of people through, and it's a very safe, accessible location. It's actually turned out to be quite ideal. I think there was one other thing you mentioned, Peter, but no, it's lost my mind. It'll come back to me.
If I might, Your Worship, it was around the idea of messaging and just being overwhelmed by the Ottawa message all the time. And I wasn't very clear, but as you're aware, the town has some very successful social media presence, and then also with the signs, the electronic signage that we've recently installed, and that was part of the rationale for installing them was mass community announcements. So if there's any messaging you can share that the town as a corporation can push out, but also we individually can push out. And when I say the corporate, I think those signs, they're at 4 locations, high profile coming into town. So that will certainly help guide folks who are from outside within RVH's area, but outside of our municipal boundaries, because we know we're going to have to partner with other municipalities to make sure that they're vaccinated as well. So those are the kinds of things, is if we can just mute the Ottawa message, which is a great message, but given their resources, they're a little further ahead than we are a number of times. And I think that adds to the frustration. So if there's a way of amplifying the message from here, which is, frankly, is a very good message, then I think that'll be helpful.
Peter, it's Chris.
Yeah, and I've
Sorry, Ange. I think we do have a communications group now with the Renfrew County District Health Unit and all of the lead hospitals, so that we're going to see more and more communication go out. And you're absolutely right. We're going to need your help, everyone's help, to get the message out to the masses, as we need to get that information to them. So that communication group will be reaching out and getting assistance from everyone to get that word out. So
I've been following that guy on the Ottawa Public Health, and honestly, I think he's blowing every public health in Canada out of the water. So it's tough because we border with them, but we've also agreed that we would all send the same messages through public health at this point, just so it is consistent. And the amount of work going into making sure that every person at every part of the county, from Barry's Bay to Arnprior, is at the same level of the priority list, so that it's fair no matter where you're living, has been a main priority of the group.
I believe Councillor Koulis had a question.
Through you, Your Worship, I did, but I had it answered by the questions that Revimo asked about time frame. Thank you.
Mayor Don?
Yes, Councillor Hines.
Through you, Your Worship. I was just wondering, how much lead time do you get to know what amount of vaccine is coming forward for next week or whatever that I know it's very trying to have to set this up so quickly, but how much lead time do you get would be my first question. And my second question would go to the Director of Recreation. Exactly what is the date that the ice is scheduled to come out? Just feeling that this is very, very important. And if we were to be able to receive a mass amount of vaccine, that I think this is high priority over maybe a skate or two. So those would be my questions or my comments. So if I could just get the first question answered, how much lead time do you have to know when the vaccine's coming?
The timing of that question is perfect. So we found out on Friday how many vaccines we would be receiving this Monday and Wednesday, which then changed on Sunday, which then changed this afternoon at 12 o'clock. So it's a very dynamic process, and we're not sure exactly why that happens, but it's very last minute. Right now, the current steady goal is to have 2,400 vaccines coming into our community, the entire county, per week. Over the next couple of weeks, we're assuming that's going to ramp up to 8,000.
Okay, Director Hill, are you with us?
Thank you for that answer.
Yes, I just wanted to comment that I've met with representatives from the RVH and expressed to them our availability of the hall. We can do it on a moment's notice. And the ice surface, to answer Councillor Hines' question, will be removed April 23rd is the last date. And it takes about 4 or 5 days to clean it up.
Thank you.
So in the meantime, Director Hill, the upstairs part of Mattaway could be used?
Absolutely. We have some programs going on. So I just asked for as much notice as possible so that we can contact. We do currently have 11 programs that are running on a weekly basis. So I'd just like to advise those programs of when we would be taking over the hall for the vaccine clinic.
Okay. Is there any other questions, Council? And again, I can't see everybody on the screen. I don't want to fool around with this until I figure it out a little better, but okay.
I think,
I think Andrew has a question.
Councillor Evans, your worship.
Mayor, if I could just cut in quickly, and I think these sentiments have been expressed already by my fellow councillors. But again, thank you very much to the representatives of RVH for coming on to YouTube or our council meeting this evening and sharing this this insight and also what you're providing to our community members at large. Much appreciated, and I'm sure it'll go an awful long way in providing some sort of comfort to the people that are sitting at home wondering what's going to happen next. And again, thank you very much. Appreciate it very, very much. Thank you.
Thank you, Councillor Evans. Okay, anyone else? Yeah, Councillor Sidney.
It's not really along the same lines as all the other questions. I don't really have a question. It's more of a statement. And I know this is very fluid and it's always changing, but because my wife is an essential worker, she actually got the vaccine yesterday, and nothing but high praise for RVH, the staff, how it rolled out, the organization of it. Very, very impressed. Dr. Barron, you give a very good needle. Apparently it was very good. But just to put it in perspective, from the time she was scheduled to get her vaccine to the time she texted me to say that it wasn't that bad was 4 minutes. So I know that's fluid. It's not always going to be that way, but for it being new and the way it's rolling out, fabulous, fabulous job. And we're very, very fortunate to have you guys. So thank you.
Okay.
Well done.
Mary, if I can.
Revimo.
Yes, thank you. Very quickly, and again, one of the messages that seems to come out of the stratosphere is about booking and the new provincial system that's supposed to be up and running tomorrow, and compatibility with Convex, I think it's called. Is that going to pose a problem for us, us being in our community, because the catchment area for Renfrew County District Health Unit is 14,000 square kilometers when you loop in over as far as Madawaska and Whitney, and I think that the capture rate or the expected rate is about 75% of the 110,000 residents. So, and given our problems with connectivity, are we going to be able to establish, a 1-800 number as well and things like that? Because I recognize the Renfrew table captures, I believe, Renfrew, Greater Madawaska, Horton, Amherst, Bromley, but the reality is that Renfrew Victoria Hospital's capture zone or whatever ends up going as far as Denbigh and beyond in some instances, and then over into Madawaska and also into Whitewater and over into Horton or over into McNabb Braeside. So is there going to be some kind of an attempt, and I don't mean that negatively, some kind of an attempt to address, just the problems we have as a system in the county getting information out to people?
I can answer that if you like, Peter. Yes, we actually have come up with a local booking system for the county that will be going live soon, very soon. We were a little reluctant to start on a provincial system on the first day and hope that it's going to work in Renfrew County. So we have a local solution that people are going to be able to book at any one of the clinics across the county, and that'll be ready soon. And our plan is to go to that provincial system, but not on the first day. There's many tables having many conversations about ways that patients will be able to phone in to book if they're unable to get online, and we're anticipating that that will be happening very soon as well. So lots of people working in the background to make it work. We've tested some of this online booking system with our healthcare workers and it's been working beautifully for people to book anywhere across the county. So just figuring out some of the logistics behind that, and hopefully you're going to hear a lot more tomorrow. So.
Okay.
Great.
Revimo.
Thank you. And I want to assure you, my questions are not criticisms. They're more as an attempt to get a little bit of explanation that allows our viewers and subsequently through the paper next week some more information, because I think all of us sitting in this room, including yourselves, get a ton of emails. I haven't been attending to mine the last couple of days, but when I opened, I had 238. And at least 60 of them had something to do with the title about vaccination. So, we get a lot of requests because in theory, we represent the community and we're supposed to have instantaneous information. So my questions are not meant as a criticism, but more as an opportunity for us to try and explain through you and through these mediums what's going on, because there's a lot of angst. We're getting some of and I think Dr. Barron and I had this conversation a while back too. I get calls from people outside the community who have a person who's a little elderly who lives alone. Do I have to come up and spend a week, sitting, waiting to take my mom, my aunt, my uncle to a clinic? Where's the clinic? How do I book them? Here I'm living in Barrie and I'm able to book automatically and go in. They promised me that. Can you do that in Renfrew County? So those are the kinds of questions we're getting. So thank you for this presentation. That certainly allows us to go back out and say, look, there's some things going on. Pay attention to our website. Pay attention to this website. There's a 1-800 number coming up. The town signs are going to be used. This media is going to be used. We're going to be boosting it personally through our social media. So just to reassure you, very happy with tonight's presentation, and thank you.
Okay. Anything from anybody else?
Mary, can I just say something quickly?
Absolutely.
Just knowing that this is on YouTube and there probably are a lot of people watching, I think in my physician role, not attached to RVH, the one thing that I would just like to say is that this pandemic has put so much chaos into everyone's lives. And our goal of this vaccination committee is just to provide the vaccine as quickly as we can get it, which is determined by the ministry, and as safely. And by safely, I mean safe for our healthcare workers. And we have taken every step possible to ensure that the safety of all of our nurses and people right from the registration desk to the paramedic who monitors you as you leave, to the safety of the patient who comes in, but also kind of a moment for those patients to just have a minute with a doctor and be like, these are my concerns about this vaccine. I've been reading all kinds of stuff on Facebook. Is it really the right vaccine for me? And when I just take 30 seconds to review the consent form and answer those patients' questions, I can just see kind of some relief. And sometimes it's just that they're afraid of a needle, because a lot of us are. But I really feel that the approach that the RVH hospital has taken, again, as an outside person looking in, has really been to maintain the quality. And I think that moving to somewhere like Mattaway, we're going to continue that completely. I guess just some reassurance that the vaccine is coming and we're going to get it as soon as it's here into those arms.
Okay. Anything from anybody else? Speak up, please, if you have. Okay. Well, what I've sort of heard here tonight seems to be maybe a question on communication. So I would say that from the town of Renfrew point of view, of course, we have our social media outlets so we can put communications out for you. We have to be careful that we follow whatever you say, so that, and if that's a changing target, we want to be informed. So we need a good streamline of communications there between ourselves and you people. And secondly, I'm sure that my FM radio they have news coming out on a daily basis pretty much. Not sure about the weekend, but so that we have a consistent message coming out that because the last thing in the world we want to do is have the town of Renfrew put something on our Facebook or et cetera, and we find out that that's not the actuality of it. So if we can keep that consistent, that would be my biggest concern, so that people know where to go, who to phone, what to do, and that message is consistent. And then getting people to the clinics, whether it be Mattaway or whether it be at the health village. I know there is organizations like Sunshine Coach, et cetera, that help people who are maybe slightly disabled or that need help getting there. So all that together, though, I'd say that you people have this thing in hand. I'm very confident in what you're doing. Have some great people with you, and it seems to be starting off in a very good way. And it's if it's going to ramp up, it'll ramp up in the next few weeks pretty quickly, I'm sure. So I'm sure you have it in hand, and thank you very much for what you're doing. And if you want to come back to another council meeting, please feel free to contact us. And because this is a good way of getting out to the public, just by sitting at a council meeting and give us a presentation. And we don't mind giving you some time here to do that. So that our door is open for that. And I'd like to see Renfrew become a town of total cooperation, and let the province of Ontario know that Renfrew, an area here, is working very hard to cooperate with everything that's going on. So thank you again very much. And if that's everything, then we'll move on to our next item. Okay. I guess I didn't ask for all in favor of the motion. All in favor? Carried. Okay. So again, thank you very much, Chris and Julie and Dr. Barron. You guys have a good evening. You're welcome to sit and watch this if you wish. It's really entertaining, I will tell you. Okay.
I got to put my kids to bed.
Well, that's a good excuse.
Thank you very much.
Thank you.
Bye-bye. Okay,
Bye now.
next motion being that the minutes of the committee of the whole meeting held electronically on February the 23rd, 2021 be adopted as printed. Mover, please. Councillor Evans, second by Councillor Jamison. Any questions or comments on the minutes?
There's a comment for you.
No questions or comments, all in favor?
You didn't want to hear my comment.
That was not my cat. That was not my cat.
Oh dear. Okay. That the minutes of the regular council meeting held electronically on February 23rd, 2021 be adopted as printed. And mover, please. Councillor Hines, seconded by Councillor Koulis. Again, any questions or comments on the minutes? Hearing none. All in favor? Carried. Okay. That's a communication from the Minister of Municipal Affairs concerning the 2021 COVID-19 recovery funding for municipalities, dated March the 4th, 2021, be received. And further, the Renfrew Town Council direct the treasurer to sign the acknowledgement, provide the necessary documents as per the requirements, and return the signed copy to the ministry. Mover, please. Councillor Sidney, second by Councillor Evans. Would Treasurer O'Reilly be, I believe he's here, could maybe give us a couple comments on this?
Thank you, Mary D. In this correspondence addressed to yourself, the municipality has been advised that we will be eligible for what's being referred to as COVID-19 recovery funding. Again, it was based on the total population of the province, and then there was a factor included based on the severity and the number of cases of COVID, depending on your geographic area. The funding that we are in line to receive is $20,444 to offset COVID-related costs in the year 2021. And it does require, first of all, the acknowledgement back, but it also requires, as outlined on page 2 of the correspondence, some detailed reporting that will take place in June and a final report back in the spring of 2022 as to how the funds were used.
Okay, thank you. Any questions or comments, council? Okay, hearing none. All in favor? Carried. Thank you. That's a communication from the Ministry of Transportation concerning the Safe Restart Agreement, SRA, dated March the 3rd, be received. For the Renfrew Town Council, direct treasurer to sign the acknowledgement, provide necessary documentation as per the requirements. I'll return the signed copy to the ministry. Mover, please. Councillor Hines, seconded by Councillor Evans. Again, any questions or comments on this? Councillor Hines, then Revimo.
Just a comment, Your Worship. This is in regard to Sunshine Coach, I take it. That's the funds are funneled through the town and the reporting from them goes through the treasurer back to the ministry. Am I correct?
That's what I understand, and as
Okay.
Treasurer Riley may want to comment on this again, I'm not sure.
Hans is quite correct. The any funding that's coming in through the Ministry of Transportation is for public transit, and the public transit service that's funded through the town of Renfrew is the Sunshine Coach service. This is referred to as phase 2 top-up funding, and later in the report you'll see that this is it's also confirming phase 3 funding. So there's been 3 different phases now. And for the Sunshine Coach, the total they've received is will be about $172,000 at the end of the day when this money here is received. The particular one here is just an announcement. Later in the meeting, there is a resolution or a report to council where there is a transfer payment agreement that requires approval by council by bylaw to accept the top up of monies under phase the initial money under phase 2. It's kind of confusing. There's a phase 1 money. There was phase 1 top up. There's phase 2 money with additional monies, and now phase 3 has been announced for the transit services. So this is, as Councillor Hines asked, specifically to do with the Sunshine Coach service.
Yep. Revimo, I believe you had your hand up.
Yeah, yes, thank you. Just a quick question on with all of these funding envelopes that are coming out. I'm assuming the Finance Committee has a calendar sorted to make sure that we get the reports back on time and get them to council on time, so there's no delays. So that wasn't really a question so much as a minor question.
Okay, I'll have to leave that in Treasurer Riley's hands to make sure that's all put together properly. I'm sure he will, as in the past. Any other questions or comments? Hearing none, all in favor? Carried. Okay, the planner Withers report dated March 4th concerning part lot control exemption, block 23, 100 Gate subdivision, phase 4. Received. Mover, please. Councillor Evans, seconded by Councillor Hines. Is planner Withers with us tonight? I don't see him on our.
He's here.
Maybe Director Asselin can give a report then.
Planner Withers.
Oh, actually, Planner Withers is with us this evening, and I see him clearly.
He's with us?
Yes,
today.
Okay. Planner Withers, you want to give the report?
Sure. So this is another part lot control application for Hunter Gate. It's for a 5-unit townhouse block. It's again, just like every other part lot control application, it was originally created as a block through the plan of subdivision, and once the townhouses are built, then they subdivide them further into their units. So that's what this is. And I think it's pretty straightforward. Appendix A shows the as-built block. And then we'll send this to the county for approval. once council is done with it.
Okay, thank you. Any questions, council? Okay. Not hearing any. All in favor? Carried. Somehow I've lost a couple council members. I'm not sure if there's something I can touch on this. Bring everybody back into focus. I don't see that.
I think if you go to gallery view,
The thing up top says view. I'm gonna try that.
yeah, and go to gallery view.
Oh my God. Where have you been all my life? I needed that. Thank you. All righty.
Oh yeah, I'm so techie. No,
Okay, the bylaw 15/2021 being the bylaw to provide the subsection 50-5 of the Planning Act, RSO 1990 C P13 as amended, does not apply to block 23 on registered plan 49M-93. Be read a first time and deemed to have been read a second time. Mover, please. Councillor Evans, second by Councillor Hines. Again, any questions or comments on this? Hearing none, all in favor? Carried. The bylaw 15/2021 being a bylaw to provide a subsection 50-5 of the Planning Act, RSO 1990 C P13 as amended, does not apply to block 23 on registered plan 49M-93, be read a third time and be passed. Mover, please. Councillor Evans, second by Councillor Hines. Any questions? Last chance. Hearing none. All in favor? Carried. Okay. Okay, the planner's weather report dated March the 4th concerning County of Renfrew official plan amendment number 31 and the town commitment letter on draft proposed amendments be received. And further, that Renfrew Town Council provide direction with respect to the submission of the comments. Mover, please. Councillor Hines, second by Councillor Evans. Turn it over to Planner Withers for the report.
Thank you, Mayor Eady. This is just a follow-up from last council meeting. Appendix A, I've drafted a letter that I believe reflects council's comments at that meeting. Attached to the letter is a chart that was prepared by the county. The coloring there is the highlighting was done by the county when they had prepared this chart. The only addition that I've made to it is a column on the right with town comments. The vast majority don't apply to the town of Renfrew. The only section of the official plan that applies to the town of Renfrew is the urban community section. So the vast majority here don't. I'll just note, maybe just for council's information, I believe most of council would be aware that the more controversial policy was removed at the meeting that this updated table was provided to council at, and county staff are going to be bringing a new draft back to committee for further discussion. So I think it might probably be a little bit of time before they actually send out a formal draft for comments, but probably as good a time as any to send in the town's preliminary comments on these current proposed amendments.
Okay, any questions, council? Councillor Hines.
Just a comment. I think I want to say thank you to Planner Withers. I think the letter really reflects in a very nice way the many comments that we had, and I think it certainly captures our intent to the county. So good job on the letter.
Yep. Anything from anybody else? Revimo.
Yes, thank you, Your Worship. And again, just echoing to Planner Withers, thank you very much for the letter. It's a nice, concise statement. Getting that appendix or the chart, you know, it's been a steady effort to knock off some of the things that are controversial to all 17 members of the county community with regards to the official plan. And there's still, I think, 4 that are fairly contentious. And as Planner Withers has said, there's another go round. And with this coming back to committee, hopefully this month, but if not next month, and then back to county council. As soon as we can get those issues resolved and then a final draft put out, then there will be circulation back to the town and the other 16 members, and then also to various provincial ministries. For comment, there's a time frame on, I can't remember it exactly now, but it looks like then the plan would be to hold public meetings to reintroduce number 31 to the community. I'm expecting, given COVID in the summer months, it looks like sometime in the fall, with the idea that then those comments would be assembled, considered, and then a final document would be given to the ministry at some point in the fall, with the hope and expectation that early next year we should get a decision. So it's been quite a journey, but the official plan has to respect the Planning Act and the provincial policy statement. And I recognize there's been some confusion that equates approval for the county, you know, the delegation of the approval to the county to, we can ignore the province. We can't, just like the town can't. There's timelines, there's all sorts of provincial policy statements, sections that are applicable, as well as the Planning Act. And were we to just throw it in the air and say, no, we're going to go our own way, we'd very quickly be bogged down in hearings. And then secondly, likely lose the ability to approve our own plan and consents and stuff like that. So, you know, thank you to council and then staff as well, and also the public for their patience. It's a pretty complex document when you're dealing with 17 municipalities with a variety of institutions and land uses, ranging from agriculture to agricultural industry to forestry to protected areas. It's not been easy, and it's not been without bruised feelings, and in some instances, not without some people losing value on their land and their expectation of being able to pursue some kind of development. So it's a work in progress, and we'll keep slugging away and get it as right as we can within the framework provided by the province, who ultimately has authority over all municipalities, not just the county of Renfrew. So thank you.
Anything else? Okay, hearing nothing, all in favor? Sorry. Okay. The Renfrew Town Council directs Planner Withers to send the town comment letter on draft proposal amendments to the County Renfrew Official Plan Amendment number 31 as appended to Planner Withers report dated March the 4th, 2021. Over, please. Councillor Evans, seconded by Councillor Sidney. Okay, any questions or comments? Hearing none, all in favor? Carried. Thank you. Okay. Director Aston's report dated March 2nd, 2021 concerning the Renfrew Water Financial Plan be received. Over, please. Councillor Hines, second by Councillor Sidney. Turned over to Director Aston for his report.
Thank you very much, Mayor Eady. Certainly, first, I'd like to say there's certainly a lot of paper associated with this report. And the town committee of the whole had met on 2 occasions in February to review the general premise of water rates and the adjustments that would be required. Touching more strictly on the financial plan, the town operates the water system under a drinking water license. And every 5 years, the town is required to reapply for a drinking water license. And there are certain elements that are required to fulfill the license. And one of them is a financial plan. And the financial plan stems from back to Walkerton tragedy, where a municipality operated a water system and there were problems, and some individuals died tragically, and a lot of other individuals got sick. So the province at that time put in legislation to ensure that municipalities were really taking a good look at the revenue sources and the expenditures, and making all the right moves to invest in the water system and the wastewater systems to ensure that Ontario residents would be guaranteed to have good quality drinking water, and that met all the standards. So this financial report is a demonstration of the town's commitment to invest in the operation and in the capital associated with the water system, and to manage its debt loads and its reserve funds, such that the water system can be operated sustainably and funded through the water revenues from the users. And there's many pieces of legislation that fit together. Watson and Associates had made a presentation at the Committee of the Whole, kind of outlining the requirements of the legislation. So with the water presentations that have been presented by Watson, and with the legislation that is attached as Appendix A, is essentially the governing legislation that sets out the requirements for the financial plan. We bring this report forward tonight, and once the report is adopted by council and passed, then we will provide a copy of it to Municipal Affairs, and also a copy to the Ministry of Environment, or the Ministry of the MECP, the Conservation and Parks, now who manages the drinking water licenses. So there's a lot of information. There's a parallel report with respect to water rates that Treasurer O'Reilly will follow up on the next report. I guess at this point, if the council has any questions with respect to the financial plan, we would try our best to respond to their questions.
Sorry about that, Revimo.
Thank you. Just turning to page 4.5, table 4.2. And I look down to expense to revenue ratio, and consistently from 2021 through to 2029, it's about 80%. And then it nosedives in 2030 to 35%. So as a report card issue for us, should we be paying attention to that on a move forward basis and maintain it at 80%? Or should we try and plan to drop it to X?
Again, there's many variables over time that do happen, and we do have to examine our plan every 5 years. For instance, since 2010, our revenues have dropped by about 46% because of the water conservation efforts and the water, the appliances. So certainly the things that we need to manage in our water system is the level of reserves that we're maintaining. So with the plan, we're predicting that the reserve levels will stay just above 200,000 at the minimum level. So as time goes on, certainly we'll have to manage many elements of the water rates, the consumption, as well as the expenditures and debt and capital projects that will be able to move forward. So the answer is yes, we will have to carefully monitor many elements of the plan, and council will be involved every 5 years to create another financial plan that looks at a minimum of 6 years forward.
Vimo.
Thank you. And again, question, just a question on page 413. At the top, there's a little graph and it 221 to 2030. So principal payments start at 321, and then at 2027 drop to 260, and then 2030 drop to 199. So would I be correct in assuming that 320-ish or 330 is a level that we have comfort with? So in 2027 through to 2030, then a council could then make some decisions about accumulating more debt, because the cutoff limit is 321 or 331, just for planning.
Yes, I would ask the treasurer perhaps would have a comment on that financial question. Page 413.
Yes, thank you. Similarly to what we're doing with the taxation fund, that's certainly an approach we could take, Revimo. However, I'd have to get into more details in the detailed water financial plan to see if perhaps those funds have already been reassigned to something else. We know ourselves that you'll see when the capital budget comes forward later this month that we've had some debt on the books, and once it's paid off, rather than have to, knowing that you're going to borrow again in 2 or 3 years, rather than reduce the operating costs just to put them back up again, we've sort of set that money aside in a reserve to offset and as you said, maintain that sort of acceptable, or that sort of that level of debt payment that has been built into the base. And that's certainly what it looks like here. And I'm sorry, mine's on the side screen here, but you're right, about $320,000 seems to be what we've been carrying for a number of years, and that would certainly be the level that could be accommodated without any further increases in either the water or wastewater rates at that point in time.
Okay. Any other questions? Okay. Hearing none. Oh, sorry, Revimo.
Sorry, and then just my last question is page A10, where we look at the water, total water billing recovery. So if we don't reach those targets, and then I couldn't find the other one, which talks about the increases in residential accounts that I think start at 9 this year and go up to something like 300 at the end of it. I'm sorry, and I'm paraphrasing because I couldn't find that. So if this is another target that we should pay attention to as a report card, so are there several report cards that you could recommend to us that are items that we should be aware of on an annual basis?
I would answer that the next bylaw that council will be asked to pass is a 2-year water and sewer rate. So every 2 years prior to setting new rates, I think there's always annually a justification of the actual revenues that we're recovering through billing. We have made a move in this project to try to recover a little bit more funds on the base charge and the water side at up to 40% of the base charges, and have the rest recovered by consumption charges. So to try to stabilize or lose a bit of sensitivity to the consumption reducing over time. So Kerry, do you have anything else to add?
That was basically going to be my comment. The forecast that's on page 810 is really dependent upon the consumption being in that 650,000 cubic meter range. For those who've been around for a while, when we first introduced water meters back before my time in 2004, 2005, the annual consumption was about 1.2 million cubic meters. We're now approaching about half of that. But the cost of the system, and again, this is what we keep emphasizing, and Director Aston just touched on it there, the majority of the costs in the water system, for example, are fixed. Whether we're producing 10,000 liters or 10,000 cubic meters of water in a day, or 100,000 cubic meters of water in a day, there's still certain fixed costs that are in the facility. And just as the volume changes, the number of chemicals in that changes, but the majority of the costs are fixed. And you're right, this is it's like a benchmark, this particular graph you're looking at, that we have to keep in mind. And typically we do that when we bring forward a budget, is that we look at what we're forecasting 10 years down the road and keep it on that sliding scale. So I could go back to 2011, for example, and say that at that time we were predicting the rates to be X dollars in 2021, and we're not too far off those. We've been fairly well done, and I think it helps to have these water financial plans done every 5 years. It's a good external review of how we're budgeting and how how we're generating revenues and that. But the biggest challenge has been the continuing decline in consumption. And just when we think it's going to plateau, it drops again. Like I said, we went from 1.2 million. It dropped down fairly quickly with energy conservation, home appliances, dishwashers, washers, things like that, where they used a lot less water. It went down to about 800,000 cubic meters. We thought it plateaued, then all of a sudden it dropped another 100,000 down to 700,000 cubic meters. So when we did the water budget 2 years ago, we used 700,000 cubic meters forecasting for 10 years. Well, now we're down to 650,000 cubic meters. So again, as it drops, the costs in the system remain relatively unchanged. So naturally the costs have to go up. So we keep saying eventually we've plateaued at some point, but we can't say with certainty that we finally have.
Yes, and I would just add on that statement, I think we're very fortunate to have modeled the system back as early as 2004. And there was a lot of pain in the years from 2004, moving forward 10, 15 years. And now with the water rates that they're predicting is just marginally over inflation looking forward for the 10 years. So many municipalities are not in that position because they have to build new plants. We've gone through a lot of the pain. I know our water rates are quite high, but they're sustainable with just over just marginally over inflationary increases. So we're very fortunate not to have to go into double-digit increases and still be able to sustain a bit of linear work on our distribution system as well.
Councillor Hines.
I was just going to say it's a bit of a balancing act, and I think Director Aslin and Treasurer O'Reilly certainly have sorted that out and stated that. The fact that it's gone down a little bit hopefully would balance out with the different new developments that we're having, and although those take a little while to come on board, but certainly hopefully we can stay around that amount. And I think the way that this whole review is laid out, that it really does explain very well where we are and where we need to be, and I think that we're in a good position, and that's exactly what Mr. Help me with his name, somebody.
Scanlon. Mr. Scanlon.
He was back there in 2004. That's what he said, that, basically in reviewing this, that we have put ourselves in a good position, that we're able to manage this.
Yes, and you're quite correct in that growth is your friend when it comes to water systems, because your costs are very much fixed. So the more users you can distribute the cost over, then the more efficient it is for all users. So definitely growth is something that is good for the water system. Our plants have sufficient capacity to grow considerably. So we have lots of room to improve the situation.
Councillor Sedney.
Thank you. Back in 2014, 2015, when we had the water rate review task force, one of the things that came out of that, and I think it's really important to note, is that you have to look at the fact that, like Director Aslin said, right? It's water in, water out. You need to use the money from your water to fix the water. It's not like you can raise taxes to fix your water. And based on the provincial guidelines from Washington and all of that stuff, I want to remind everybody, we're taking water. Our water source may not be the cleanest in the world, but it's coming out drinkable, meeting all of the provincial guidelines. And that takes effort, and it takes money, and it takes all that stuff. So I think I know there'll be a bit of backlash on the price of the water rates and all that stuff. But when you look at the source of our water, how it comes out, you can bathe in it, you can drink it, you can eat it. All of that stuff, we're doing pretty well considering. And as what Councillor Hines said, with growth, that will help. And I think it's, with all of the new technologies, as everybody's mentioned, water rates have gone down. People are more conservative with using water. But at the end of the day, this really comes down to us meeting the provincial rule. So, we do the best we can with what we got.
Yes,
Anything
and,
else?
or, go ahead.
Okay, Revimo and then Director Aston.
Yes, thank you. I don't want to leave any mistakes on the table. I like the fact that we've used a very conservative number of 650 cubic meters. You know, when you look at the trends, that's good. I also just wanted to ensure that I had an understanding of what benchmarks were going to be important going forward to make sure we meet our targets. This is a pretty complex document in a lot of ways, with a lot of formulas that are shoved into a chart. And that's not a negative term because I can't figure out the algorithms and the way they got there. So I have a few things I track just to pay attention to it. So those are the things that I thought were important. And, you know, maybe something that the general public will also keep an eye on because, you know, everybody worries about debt, but I think the number of 331,000 looks like a comfort zone for future councils. And then when I was asking about the ratio simply so I would have an understanding about some kind of a benchmark, and it sounds like it's acceptable to the consultant and then through the consultant to staff. And then I'm assuming that nobody at the ministry will tag it as well because it look, you know, that kind of consistency. So those are those were why I was raising those questions. Have a comfort level with where we are with it and with the plan that's been put forward. So thank you.
Okay, Director Ashton, last comments?
Just the last comment along the lines of Councillor Sydney is a lot of people turn the tap and the water comes out and, you know, they don't realize the effort. Some of the best measures that we've taken is to invite people to come and tour our water plants. And unfortunately with COVID, it's very difficult to do that. But soon as COVID is behind us, we'll open up those tours to the water plant and sewage plant again. And invite the public to come and see essentially what their water and sewer rates are supporting and to be very impressed because there is a lot of technology, a lot of very complex equipment to properly treat water. You know, we're doing more work on our water tower again this year to make sure that we're taking care of the town's water system. And it's not a small task, it's very complex. And I think we're doing quite well, although you know, we do feel the pain that the water rates are high, and it's a considerable bill for each resident to pay for the things that we need to treat water properly. So yeah, certainly we look forward to inviting the public to come and view our facilities soon.
I guess if you're talking rates, what I heard earlier on this here, we're kind of in the middle of the pack. We're certainly not the highest around, and we're not the lowest around. So we're kind of in the middle. Do I understand it, Director Aston?
That's correct. We're in the middle, and I would say we're in a good position in the middle in that we've invested in our water treatment plants and our major infrastructure is in really good shape. So many municipalities that might be beside us in the middle of the pack as far as our water rates may still have improvements to their water system to make at substantial cost. So I think as time goes on, I think our rates will be lower than others in the pack. So we're currently at the middle, but we've invested heavily in rebuilding our infrastructure.
Okay. Any other questions or comments? Hearing none. All in favor? Carried.
Thank you very much.
Okay. The Renfrew Town Council approved the financial plan for the Renfrew drinking water system prepared by Watson and Associates dated March the 3rd, 2021. And further, that notice of availability of the financial plan be advertised and a copy placed on the town website. Further, that the financial plan and Renfrew Town Council resolution approving the financial plan be submitted to the Minister of Municipal Affairs and Housing with a copy to the Minister of Environment, Conservation and Parks, MECP, satisfying the legislative requirements. Mover, please. Councillor Hines, second by Councillor Evans. Any questions or comments? Hearing none. All in favor? Carried. Thank you. That the water and wastewater rate study prepared by Watson and Associates Economics Limited for the town of Renfrew dated March the 3rd, 2021 be received. Over, please. Councillor Jamison, second by Councillor Evans. Turn it over to Director Aston for the report here on this.
To say this report was authored by Treasurer O'Reilly, so I wouldn't want to steal his thunder on this one, and so I'll turn it over to Treasurer O'Reilly if he doesn't mind.
Okay.
Actually, to be quite accurate, the report we're looking at was actually authored by Watson and Associates. This isn't my report. It was one that was, I can take the time if you'd like. It's 182 pages long and I can read it to you. But my report to set the rates for 2021 and 2022 is a separate report following this. Council has seen the water and wastewater rate study on 2 occasions at committee of the whole meetings. I can try to respond to any specific questions there may be, but to try to go through a document of that length and explain it, basically, it flows, the water financial plan that we just spoke about for the last 10 minutes actually flows out of the rate review because the 2 projects are very similar. The water rate study determines what rates are going to be required to support the system, and the water financial plan then just justifies that and adding more details, although the more details shorten the report by a factor of 2/3 for somehow. I don't know how that worked, but the water financial plan is only 50 some pages long. Anyway, that's, you know, the rate study is there. It will be posted again on the website as well, but if there's specific questions, I can respond to it, but I will highlight some of it during my report on establishing the water and wastewater rates for 2021 and 2022 momentarily.
Okay, is council okay with that? Okay, and all in favor? Carried, thank you. I didn't want to have to listen to him for 180 some pages, I'll tell you. Okay, the Treasurer's report dated March the 3rd, 2021 concerning the water and wastewater rates for 2021 and 2022 be received. A mover, please. Councillor Jamison, seconded by Revimo. Turn it over to Treasurer O'Reilly now for the report. I think you're on mute, Treasurer O'Reilly.
I was saying that for my report, I will very slowly read to the 182-page document so that everyone is on the same page. But on seriously, to highlight it, what's being recommended this evening, and based on the level of effort that's gone into completing this water and wastewater rate study by all parties involved, staff from the municipality as well as Watson and Associates and Aqua and Dillon Engineering, we're recommending that council approve the proposed water and wastewater rates for both 2021 and 2022 to establish that, you know, the predictability. And I think the model, the way it's been developed, is showing that it is working by doing that we're able to maintain the rates that are being forecast. Just to highlight some of the main things in the report, the rate study for looking at 2020, and I'm just now speaking about 2021 and 2022, although the rate study covers a 10-year period. In this current year, there are forecasted capital expenditures, so maintaining the system, of just short of $2 million on the water side, $1,987,000, and just short of $2 million on the wastewater side, $1,998,000. So there's $4 million in new capital being invested in the water and wastewater systems in 2021. That'll be followed up by just short of $1 million on water and about $750,000 on wastewater in 2022. So significant capital investments taking place in the first 2 years, but that's indicative of what will take place over the next 10 years as well as we start replacing aging infrastructure. On the operating side of things, we're looking at total operating costs for water of $1.8 million in both 2021 and slightly higher in 2022, and of $1.6 million in 2021 and 2022 on the wastewater side of things. So when you add that all together, you've got about a pretty close to a $6 million operation for water and wastewater, and that's something I think people kind of forget that it is of that magnitude. The bottom line is, and Director Aston referred to it more than once, that we are looking at at rate increases, and the increases are, I think the consultant said it best, that slightly or marginally higher than the rate of inflation. And the best way to quantify this, because there's a combination this year of a change in the base rates, so that, as Director Aslan said, we will recover phasing it in over the next 8 years, we'll recover 40% of our total costs on the water side through the base charges. We're currently only getting 32%, even though the majority of the costs are fixed. And we already are at 40% on the wastewater side. So we have to look at the total bill to see what the impact is on the average ratepayer. So when you look at the proposed rates that are in the report, is based on the average residential household, which uses about 11 cubic meters of water per month, or 22 meters per billing period. What those people will see is an annual billing increase, of $27.50 in 2021, which is $2.29 a month. And going forward into 2022, it'll be a further increase of $28.82 for the year, or $2.40 per month. So I have often said, when I talk about the water and wastewater rates, if you talk about percentages, it can get pretty scary, because you're talking about, an 8% increase, which is 3 cents on a cubic meter. But when you look at the bottom line and figure out what the total bill for the average family, and again, the average family here, using in the consultant's report, they said 131 cubic meters per year, which is just slightly shy of 11 cubic meters per month. That is the average residential usage for the municipality. The rate increase amounts to, as I said, $27.50 for the entire year for 2021, and $28.82 per year for the entire year for 2022. So I think that's a good news item. The bylaw that is before council tonight does include the rate structure. If you look at the base charges on the water side, the rates are increasing at a higher rate than they are on the wastewater side. We've explained that. And then the rates on the water side are increasing at a lesser rate. And in fact, on the wastewater side, the combined rate's only increasing by 1%. So again, water is going up by about 4%, wastewater is going up by about 1. And when you combine the two of them together, we're looking at a 2.4% increase in 2021 and a further 2.4% increase in 2022.
Okay, council, any questions? Revimo.
Thank you, Your Worship, and through you to, I believe, Director Aslan. It says here, OREG 45307 requires at a minimum of 6 years. You mentioned a 5-year review. So will we be doing this in 5 years, or can we do an interim report card? But I'm just, I want to tidy up those dates in my mind.
Yes, so the financial plan and the drinking water license requires a 5-year renewal, but with the, I guess sometimes there's delays that could be built into the system. So they require the financial plans to span a minimum of 6 years. And in our case, our water and sewer rate study includes rates that push out 10 years. So I think we're in good shape to look at it in 5 years as we require, and then we'll make sure at that time that we push the water rates out to another 6 years in our projections.
Okay, any other questions?
Thank you.
Okay, hearing none, all in favor? Carried. Okay. The bylaw 14-2021, being a bylaw to provide user fees for the consumption of water and the use of wastewater systems for 2021 and 2022 be read a first time and deemed to have been read a second time. Mover, please. Councillor Evans, second by Councillor Jamieson. Again, any questions or comments? Hearing none, all in favor? Carried. The bylaw 14-2021, being the bylaw to provide user fees for the consumption of water and the use of wastewater system for 2021 and 2022 be read a third time and be passed. Mover, please. Councillor Evans, second by Councillor Hines. Okay, any questions or comments? Revimo.
I think I I recognize, as Treasurer O'Reilly said, that when you start talking percentages, it can be a little frightening or a little worrisome for folks. So I think when you take a look at the numbers, there are increases, but they're not onerous to most people. They may cause tightening of budgets, and we have to apologize for that. But I think it's important that it's responsible governance and accountability to post it out as long as you can. And I think a 10-year plan is important. And I think that's one of the things we've tried to do with any number of our operations over the last few years is post it out so people have some predictability within their own budgeting, and just to over a longer cycle rather than a month to month. So I think it's important to pass something like this that can help people govern their expectations. So I'm in favor of this.
Okay. Anything else? There's nothing. All in favor? Carried. Thank you. The Treasurer Riley's report dated March 4th concerning the transfer payment agreement for the Safe Restart Agreement SRA Phase 2 municipal transit funding be received. Mover, please. Councillor Evans, second by Councillor Jemison. Again, any questions on this? I think Treasurer Riley gave us a pretty good idea a little before there. So if I gather correctly, Treasurer Riley, the funding will be, is it 5993?
Correct.
Okay, thank you. The other questions? Hearing none, all in favor? Carried. Okay, the bylaw 13-2021 being a bylaw to authorize the mayor and clerk to execute a transfer payment agreement for the Safe Restart Agreement SRA Phase 2 municipal transit funding between Her Majesty the Queen in the right of the province of Ontario as represented by the Minister of Transportation for the province of Ontario and the town of Renfrew be read a first time and deemed to have been read a second time. Over, please. Councillor Hines, second by Councillor Sidney. Again, any questions or comments? Hearing none, all in favor? Carried. The bylaw 13-2021 being a bylaw to authorize the mayor and clerk to execute a transfer payment agreement for the Safe Restart Agreement SRA Phase 2 municipal transit funding between Her Majesty the Queen in the right of the province of Ontario as represented by the Minister of Transportation for the province of Ontario and the town of Renfrew be read a third time and be passed. Over, please. Councillor Evans, second by Councillor Jemison. Again, last chance. Any questions? Hearing none. All in favor? Carried. Thank you. Okay. That the minutes from the Fire and Emergency Management Committee meeting held on February the 16th, 2021 be received. Mover, please. Councillor Hines, second by Councillor Sidney. Turned over to Councillor Hines for the report.
Thank you, Your Worship. This was the Fire and Emergency Management meeting of February 16th. And we did confirm the minutes of January 19. And then we moved on to the reports that the chief had provided. And we had the proposed schedule for the 2021 emergency planning activities. And that includes a special exercise that will take place later in the year. And the fire committee is also the emergency management committee also. Then we moved on to the fire department summary action report for January 2021, and you've all received that via email. And just to highlight that, and I'm sure the chief will go over that somewhat, but I draw your attention to the number of burn permits that we're talking February here or January, and how many we've already issued for this year. So people are interested in that, and certainly complying with the bylaw that's in place, that they need to have that permit in order to have a fire in their backyard. We also reviewed the volunteer firefighter recruitment report, and that's coming before you, I believe, on the next item on this agenda. In regard to the operating budget, that has been submitted to the treasurer, and the finance committee will be looking at those operating numbers, or those budget numbers for the fire department and the other departments. Under new and unfinished business, we continue to have the 2021 priorities, and we don't have any changes to it at this time, but we continue to talk about things that we want to do in 2021, and that's certainly a celebration of the fire hall itself. And further discussion, we did look into the utilization of employee assistance program. We don't have anything back on that yet, but the fire committee does want to review how much that's used or not used, and how we might assist in that way. Also, just to note, even though with COVID, the firefighters continue to receive in-house annual training on proper lifting. We had some questions about that because they are called from time to time to assist other agencies such as the police and the paramedics. And also we're talking about undertaking a master fire plan, and that would consist of looking at what we have now and possible growth, and just be ready for any big changes in growth. And also the tiered response, that has been part of the LEG report that we received, and that's working with other municipalities in regard to fire. So we do have a committee that is dealing with that out of the municipality, the mayor and the clerk, and I believe several members of different departments, depending on what the efficiencies that might happen. So we continue to be very supportive of that, and if we can help our neighbors, and we have several contracts in place that do help them, and with their fire service, and we continue to be very supportive of that. So if I could just turn it over to the chief at this point, Chief Walsh, to kind of highlight for you the summary report for January 2021.
Mary Dee, thank you, Chair Hines. I'm just going to try and minimize my screen here so I can take a quick look at the report that was presented as part of the minutes for the February meeting. So what we have had seen in the year so far is that we've had an uptick in the number of calls throughout the month of January compared to January of 2020. Part of what we had seen throughout the entire year last year was a reduction in the total number of calls, significantly attributed to the pandemic and people being at home, being a little bit more safety conscious. I'm not suggesting for a minute that that has changed. What you'll see here this year is that we've had three or four calls to our neighboring departments, those contracts that the chair had just spoke of, and our opportunity to be part and parcel of the safety of our neighbors has seen a little bit of an uptick this year that didn't occur last year. The biggest item that we can see as far as the ongoing work is the training that we do, the maintenance of our vehicle equipment, rolling stock, as well as our small engines and small equipment that's done in-house as a savings, so that we don't have to continually be shopping out that work to larger communities. And our priority continues to be on the COVID cleaning within the station. At the end of each shift, our staff are required to clean up all the commonly touched areas so that we ensure that those individuals coming on to shift have a clean environment to work in, and that's not starting off the day in a bad spot. As the chair touched on, we have seen a marked increase in the number of open air recreational burning permits that have been sold during January this year. A significant number of those, I would think, of the total that are accounted for the month. I think about 70% of those are renewals, which is nice to see. People wanted to have the continuation of their ability to enjoy that recreational opportunity, whether the pandemic continues to keep us in our homes or whether it lifts and has us an opportunity to get out and share our space with others. The desire to have a recreational open air burning permit and having that opportunity within their homes continues to be a priority for a significant number of people. Without letting the cat out of the bag, the continued opportunity for the sales has extended into February and continues into March. So we've benefited somewhat from the fairly mild winter, if I could use that phrase, notwithstanding some of the cold nights and the -20 and -25 temperatures we've had. Overall, the snowpack and the desire to have the opportunity to be out hasn't been dampened by some of the residents of the town. So we see those numbers continuing to grow, and I think we will do a very good job of making sure that everybody that wants to have that opportunity will enjoy it. Unless there's specific questions about the report, that's the highlights as far as I can tell.
Any questions? Okay, hearing none, all in favor? Carried, thank you. Okay. The Chief's Wellness report dated March 2nd, 2021 concerning the recruitment of volunteer firefighters for the Town of Renfrew Fire Department they received. Mover, please. Councillor Hines, second by Revimo. Turn over to our Chief Welch for the report.
Thank you, Your Worship, through you to the rest of council. As everyone is very familiar, the town of Renfrew is serviced by a composite fire department that's, as you see in the background, composed currently of 10 career firefighters and upwards of 7 to 8 volunteers at the present time. Typically, the numbers could float upwards as high as 20. And as a result of some changes in some of the availabilities of our staff, there's a need to take a look at the opportunity to supplement our resources right now. You'll notice the 2 Nfpa standards that are referenced, neither one of which are directly applicable to a composite department. They deal with the expectation of having efficient and sufficient numbers of staff available at a structure fire. The structure fires are defined as a single family home of 2,000 square feet without a basement. And these are the numbers that are recommended by industry practitioners, be they administrators or be they frontline suppression officers or just administrators of the fire department. It's commonly accepted practice and industry standard to have 17 people on site to deal with that sort of a structure fire. And those numbers provide us the opportunity to either suppress the fire or effect a rescue. They don't provide us the opportunity with both. Our current complement within the town is putting us dangerously at the level of any event in the town having to have all the members of the department show up and be available for that sort of a structure fire to provide the level of service that our citizens expect and deserve. To that end, the report has been brought forward with the request to engage in a recruitment process to add on new individual volunteers to get them trained up to the level of their ability to be part of our response team and provide that, again, level of service that our citizens demand and expect of us. So it's been presented for the committee's consideration. The committee accepted the recommendation and fully supports it, as well, not only if I may quote them, not only the recruitment, but also the financing of that. And as you see with the treasurer's comments, that isn't currently included in the budget for the year. There has been some capital monies put aside for replacement of bunker gear, some this year and some in 3 years' time, but it did not have the consideration necessary for the upwards of $3,000 per unit for each additional volunteer firefighter that we would add to our current complement.
Any questions? Okay, hearing none. All in favor? Carried. Okay. The Renfrew Town Council approved the recruitment of volunteer firefighters as identified in Chief Welch's report. Mover, please. Councillor Hyden, second by Councillor Jemison. Again, any questions or comments? Councillor Hines.
Just a comment in regard to, in relationship to the financial comment that it's not included in the budget at the moment, but certainly the fire department and the chief specifically have certainly made inroads into I mean, we had the sale of water before, but that seems to be increased a little bit, and certainly the sale of the burn permit. So I think through the committee, we can certainly put that as a line in our budget and be able to offset it with those revenues that we are now taking in. And as you know, we've done some other changes in regard to reports that real estate need and from the fire department, and the cost of those reports that is being paid. So I don't think that this is an onerous cost for what we will be receiving out of these volunteers. And I think it's very important that we hear what the chief said in regard to the number of people that we do have on board in the capacity of volunteers to assist the regular firefighters.
Okay. Any other questions or comments? Councillor Sidney.
Maybe if Chief Welch comes back, I'm just wondering if, you know, I know when I was on the fire committee, it was mentioned before, but I'm wondering what the plan is to recruit and sustain female members from the community as well as BIPOC members of our community. I know Renfrew has been pretty consistent with it being pretty much male-based, and I think discussions that we've had previously, I was wondering if there's a marketing strategy to make sure that we encourage all citizens of Renfrew who meet qualifications to apply.
Through your worship, to Councillor Sidney and all members of the committee of the council, thank you for that question. That one of the elements that have been a primary focus for the fire service over the last 5 years is in doing a better job of having a representation on the fire department of the communities that they serve, having the diversity that's represented within those communities. And part of the opportunity available to us now as to reach one of my targets when I came here was to see a change in the composition of the department, inclusive of at least females at that point in time, and hopefully any and all individuals that are interested. The messaging that needs to go out, I haven't got a detailed plan in place, but the consideration is obviously there to ensure that all individuals that would be interested in this process are encouraged to participate in the recruitment. And we haven't finalized the recruitment process specifically, whether there'll be a job-related skills test associated with that. But ensuring that if we do, that the tests will have a spectrum of acceptable standards to achieve to be considered as a possible candidate. But thank you for that question. It is a primary objective of the department to become a little bit more representative of the community that we serve.
Good, thank you.
Okay. Any other questions? Hearing none, all in favor? Carried. Okay. The Director Aslan's report dated March 3rd, 2021, concerning the vacancy of the general foreman position in the Development and Works Department be received. Over, please. Councillor Coolidge, seconded by Councillor Hines. Turn it over to for the report.
Okay, thank you, Mayor Eady and Council. I was just reflecting and presentation of this report, and I realize that we've now, with this retirement of the general foreman, that's 3 general foremen that have retired at the end of their careers since I've been hired here. So if you think back on the level of service that has been provided in public works, I think you'll agree that there's been a fairly consistent level of service that has happened over that time period, and the services, even though there's personnel changes, things click along pretty well. In this particular case, our general foreman is a key supervisory position responsible for the public works field operations under the direction of the director of development works. That's me. And they require extensive knowledge in waterworks, public works, wastewater, and they have to have the ability to be licensed in the Ministry of Environment drinking water licenses and wastewater collection licenses, as well as have the aptitude to respond to any type of emergency that occurs in public works and direct the 12 staff members that are part of the bargaining unit to respond appropriately to any emergencies in a timely manner. So these this kind of activity has happened over the years, and in our case, Rick Trahand, who joined the town in 2016, was as assistant foreman, was promoted to the general foreman in 2018, and then after 4.5 years approximately, he's ready to retire, and he has served in Arnprior and Ottawa, and has been a member of the public works field for a very long time, and I know that he watches these meetings, so I want to thank Rick for his service, and I've worked with Rick for many years, and it takes a very high level of dedication to work in that field through all the weather conditions and do whatever's required. So Rick will be retiring formally in December 31st of 2021, but with the time that he's accrued, he'll be away from the town by using vacations and what have you. He'll be away at the beginning of August of 2021. So we are initiating a recruitment program for the general foreman. And I have to say that in our hires, right from the maintenance labor positions all the way through, we've done a lot of succession planning and training of individuals in our organization to take on more responsibility and have drinking water licenses and have them in a position that they can move up through the organization. And I think we've done quite well in succession planning. So this report is asking permission of the council to declare this position vacant when Rick retires, and to begin the recruitment process to fill the general foreman's position. And understanding that if there's internal candidates that move up from another position to the general foreman's position, that will create another vacancy. And then if there's another staff member that may move from maintenance labor or an operator to the assistant, that may create another vacancy. So there's sort of like a cascading effect, which will open up a new position for the public to compete. So we are asking permission to do the recruitment and interviews and fill the position of foreman, and as well any positions that are any vacancies that are created in the process of moving through that recruitment process. So we do have three options. The one option is do not fill the foreman's position, which we are not recommending since the position is a very key supervisory position, and with the 12 staff members of the unionized force, it's a very important position. The second alternative is to accept the recommendations that I've set forth in my report to do the recruitment and hiring. And the third option available to council is to identify some alternative recruitment process that is something that's not addressed in the report. So with that, I would ask if council have any questions that I can answer, and we'll try to move forward.
Okay, council, any questions? Councillor Hines.
Just to clarify that, Director Aslam, I understand the premise on declaring the position vacant, and you're looking to begin that advertising process now, so that you're kind of ready for August or December?
Yes, we would very much start the process now and have a candidate selected ready to begin work on August 1st.
Okay.
Okay, anything else? Okay, hearing
Thanks.
nothing, all in favor? Carried.
Okay, thank you very much.
Okay. The Renfrew Town Council declares the position of general foreman to be vacant effective August 1st, 2021, and authorize the Director of Development Works to advertise internally, interview, and fill the position. And further, the Renfrew Town Council provides the Director of Development Works the authority to declare the positions vacant for vacancies that are created as a result of successful internal candidates being promoted, and to advertise internally, interview, and fill the position of assistant foreman and maintenance labor if recruitment of internal candidates creates vacancies. Mover, please. Councillor Koulis, second by Councillor Sidney. Okay, any questions on this? Okay, hearing none, all in favor? Carried, thank you. Okay, is there any new or unfinished business? I have one item. Was at the annual general meeting this morning for the Chamber of Commerce, and I'd like to congratulate Councillor Sidney on being nominated as president of the Chamber again for this year. So congratulations, Councillor Sidney.
Thank you.
Meeting went very well. It was well organized, and seemed it was very businesslike, and it was actually a very good meeting. Anything else for new and unfinished business? And saying, if you don't mind, Revimo, just on behalf of the town, I'd like to pass on condolences on the loss of your mother-in-law.
Thank you, Your Worship. That's quite kind of you.
Okay. Anything else? Okay. Now we get to the important stuff here. The bylaw 16/2021 being a bylaw to confirm the proceedings of the Council of the Corporation of Town Renfrew, meeting held March 9th, 2021, be read the first time and deemed to have been read the second time. Mover, please. Councillor Hines, seconded by. Sorry, I didn't catch the seconder. Councillor Sidney. All in favor? Carried. The bylaw 16/2021 being a bylaw to confirm the proceedings of the Council of the Corporation of Town Renfrew, meeting held March 9th, 2021, be read a third time and be passed. Mover, please. Councillor Revimo, second by Councillor Jamison. Again, all in favor? We do now adjourn, and it is 8:53. Okay, that's great.